For the past 8 years, the Alberta Children's Hospital Foundation has funded the Mental Health Literacy Project. We wanted to pause and say thank you and let you know what we've accomplished through your generous support. The SMILES Project, School Mental Health Improvements for Literacy in Educators and Students, started in Calgary. And the first thing we learned was that nobody could remember what the SMILES acronym stood for, so we called it the Mental Health Literacy Project. And that stuck. The project used materials designed by renowned Canadian psychiatrist Dr. Stan Kuchar and his team at teenmentalhealth.org. The main focus of these materials are the 4 key pillars of mental health literacy: the ability to obtain and maintain strong mental health, understand mental disorders and their treatments, reduce stigma, and knowing how to get help when you need it. Mental health literacy can be taught in schools, through lessons to students, and training for educators. Equipped with these evidence-based resources, we started training in Calgary with local school boards as partners. We taught teachers, who in turn taught their students about mental health literacy. Then, the training grew, and it started to spread out to other professionals who work with youth. Teachers aptly pointed out that parents could also benefit from learning from mental health literacy concepts. So, in collaboration with Dr. Kuchar, we designed and delivered training for parents too. Here's the impact we discovered. The quality of referrals in Calgary improved significantly from schools who received the mental health literacy training. Students were correctly identified by educators earlier and got the help that they needed. Word of this success got out to school boards all across Alberta. So, in 2016, Alberta Health Services established permanent ongoing funding for the Alberta Mental Health Literacy Project.
In the Red Deer Public School District alone, the work of teen mental health has the potential to impact more than 25,000 people by laying out a very simple plan for what most school districts see as a complex challenge. Beyond that, the excellent professionals at Teen Mental Health have offered ongoing support to our district. The work of teen mental health has become the work of Red Deer Public.
With our help, school districts started to implement mental health literacy materials for their unique populations, create locally developed courses, and additional resources for teachers and students.
A critical goal in our division is to build a shared language around mental health to decrease stigma and better align with the work of mental health professionals providing targeted and specialized services in schools. The staff from teenmentalhealth.org have been the critical go-to external resource that my division unit has relied upon to help us meet this goal. What I appreciate most about these folks providing mental health literacy is that they understand the intersectional and diverse needs in schools, allowing us to adapt and differentiate resources.
Meanwhile, the news of our Alberta Mental Health Literacy Project and teenmentalhealth.org continued to spread to other provinces.
The Teen Mental Health Curriculum Resource has underpinned professional development for district leaders and go-to educators across BC's 60 school districts. This has made an important impact on school communities, and the BC Ministry of Education has integrated mental health literacy as one of the 3 pillars in its mental health promotion in schools strategy.
Core trainers are now delivering training across the country in Saskatchewan, Northwest Territories, New Brunswick, PEI, and Nova Scotia. The Mental Health Academy is our way of training people from across Canada and around the world. We now have a network of trainers in places like Finland, Ireland, Germany, Brazil, Romania, the UK, Jamaica, and across the US. Resources have been translated into French, German, Finnish, Blackfoot, and Cree. Some of those materials are now being used in school boards around the world. In 2018, Dr. Kuchar was appointed to the Canadian Senate. We were all very proud. And graciously, he gifted the intellectual property of teenmentalhealth.org to Alberta Health Services. And what a gift this was. This means that teenmentalhealth.org and Alberta Mental Health Literacy Project are now one. There's more. We've partnered with several post-secondary institutions, and UBC hosts an online teacher site that has seen over 10,000 educators complete the mental health literacy training. Numerous education students and new service teachers take mental health literacy training as a part of their teaching degree. Our transitions materials, designed to support first-year post-secondary students, have also been utilized extensively in the UK and internationally. In fact, a multi-country study is currently taking place to evaluate the effectiveness of transition materials across multiple cultural landscapes, including Finland, Japan, Argentina, Kenya, and Indonesia. The counterpart resource to transitions is called Know Before You Go. It's a life skills course for secondary students who are about to leave high school. It addresses topics like balancing a budget, having a roommate, navigating relationships, and of course, mental health literacy. In 2017, with partners from Indigenous communities across Canada, we started the development of mental health literacy resource for Indigenous youth. We were subsequently awarded funding from the federal government to help with this important work.
My hope for this project is to create awareness for mental health so that Indigenous youth don't feel alienated when facing challenges, but instead understood by others and by themselves, that they are given support and the resources to live a healthy life.
We know that early intervention with mental health is key, and while our materials focus on youth, we also knew we could start even earlier to reach students and teachers in younger grades. So, in 2019, the ACHF gave us funding for the development of mental health literacy materials for elementary students specifically. We're going to follow our template of creating free, high-quality, evidence-based resources that are classroom ready. Once developed, they can be used across Alberta and around the world. And if all that isn't enough, when COVID-19 happened, we had to quickly shift gears to deliver our training online, and to support others in doing so as well. We provided COVID-specific resources to parents, schools, and students to help them cope with the mental health impacts. In the midst of COVID, we partnered with the Pan American World Health Organization and conducted a national online training for Jamaica, where all the students will receive classroom materials. This partnership opens up potential future training opportunities for all Pan American members. Meanwhile, closer to home, we continue to offer our mental health literacy training to educators, local organizations, city departments, and any other interested child and youth serving agencies. Lastly, through joint research projects, publications, conferences, we've been sharing our knowledge and learning new lessons along the way too. So again, a big thank you, because none of this would have happened without your initial donation and support. We're excited to see how the mental health literacy movement will continue to grow in Alberta and beyond.